After so many years of being a fertility doctor, this moment's always feel like the first. Brooke, a dear patient of mine, to me and Dr. Naja came to visit along with her adorable daughter, Evan. And the best of all, we got to show Evan where she was conceived. It's moments like these that I feel true meaning in my work. This is a day I will never forget. What a pleasure. I'm so excited today. One of my favorite patients, Brooke, is here to join us at Luk. Fertility is a very lonely journey. And we are trying to tell patients that you're not alone. And it is something very hard, tough to the soul. And how can you get that resilience and that strength to move on is something that we want to reverberate during our show. So welcome, Brooke.
Thank you so much for having me.
So Brooke, talk to me a little bit about how your experience, how do we know each other, actually? Let's go and start with that.
Yeah, we know each other because a good friend of mine was one of your first patients at a clinic on the Upper West Side. I believe it was 2013. I got my first round of bloods and tried to figure out sort of where we were.
And how many years ago was that?
That was 2013. So yeah. I know.
That was way before COVID.
Way before COVID. I was diagnosed in 2011 with rheumatoid arthritis, and the doctors wanted me to take a bunch of medications that were skull and crossbones.
Now, Brooke, do you want to share with us, how old were you? Because rheumatoid arthritis is supposed to be a very older diagnosis.
It's very rare to get diagnosed in your 30s. I was 36 when I got diagnosed. Wow. Usually it's juvenile or older. So during my journey with you, I sort of was navigating fertility along with the rheumatoid factor, which was very hard to find rheumatologists in the city that had the experience and wanted to sort of weigh in, which is why it's such a blessing that we found each other, because you guys, and the doctors that you suggested to me really got me through those times. I think it was about 7 or 8 years, navigating the inflammation, the extra protocols that needed to happen, everything that was going on. So by 2013, they said, hey, your AMH is fine. Got a hysteroscopy, fine.
What was your AMH then?
Oh, gosh.
1 point something. I remember it's between 1 and 2.
It was
not bad. Yeah. And you got lots of eggs. I still remember. Yes.
It was all about quality. And then later on, about making sure that my body wasn't attacking the embryo and the autoimmune component. And you were humble enough, which I love. What I love about your medicine and Dr. Najat is it's always, let's do the best thing for this patient. Let's figure out this snowflake.
Yes.
What does this snowflake need?
So I'm going to bring back the journey to how, because you didn't come to me first, correct?
I got my bloods at Columbia and then we came straight to you.
Okay. And then at that point, so you never had any IVF cycle elsewhere? No. I was kind of your first.
Yes.
Okay.
Yes.
And I know we're going to share with the audience a story. It's it's the first pregnancy, it's nothing is straightforward. Right. Because that is the amazing about Luk. Everyone who come here there's a story and years to it.
Yes.
The units, not days.
Years.
Months and years, usually, the units are. And so share with the audience, how many cycles did
I was trying to remember. We would get 3 blastocysts. We would implant 2. It wouldn't take. We would do it again. We would do a round. We would get another, implant 2. And by the 3rd time when they weren't taking, we really started to notice the spikes and the lows in the hormone process and how that affected my joints. So in tandem, I used my body as a professional. So the aches and the pains that would happen during those times, I would really have to stop and let my body recover like everyone else does.
And what did your rheumatologist say? Why are you in pain? You were in pain, actually, I remember.
All the time.
When you get into the middle, when the estrogen is really high, you would say, Luke, I said, how many days you can tolerate? So maybe 1. And I don't. And then at that point, I also worry about hyperstimulation.
Yes.
So I didn't know, are you pain here? Are you pain? I was actually getting is it related to estrogen? Is it directly from the ovary or is it from the joints? But obviously every time we start to understand, because at the first time I was so I was very actually like kind of like, oh my gosh, you're in so much pain.
Yeah,
And I didn't know it was a hyperstimulation versus joint pains or muscle pains.
We were figuring it out together. And then around the third time we were going to implant, you said, I know this man, this doctor, his methods are out of the box. They are, they're not for the weak. And Dr. Alexander Kofinas, you sent us out there and you said, I don't want to do another implantation until we try to see if he can help you with the autoimmune component.
Right.
And we did a ton of tests and bloods with him. And we got pregnant. It's 2016. So that was 3 years later, we got pregnant and I miscarried at, I believe, 8 weeks. And then did we do genetics? So none of these embryos were tested? That pregnancy was not tested. Then we went back to the drawing board with Dr. Kofinas on board with intralipids, Lobinox, metformin, about 30 supplements a day. I mean, it was just incredible, the amount extra that goes along with the hormones. But we were committed and we believed in what he had to say about placenta health and blood flow and how it was really important. And so then we started to test embryos and we were getting not viable embryos. And then...
But Brooke, we always get, and I want to give the audience a sense, quantity was never to me a problem. Mm-hmm. We always get like 9 to like 15 teenish eggs. Pretty good. I mean, they're not all immature. There will be 80 to 90. It's like what I explained to all my patients, 70 to 90% are usually mature and then fertilized. So then it's like a drop. And then 70 at the end, we may have 3 or 4 blastocysts. Mm-hmm. And I may have explained to you that blastocysts, when you get too many, I need to start testing because you cannot have 4 great embryos.
Right.
And then I start to see the joint and because you didn't get pregnant with the untested fresh transfer at the beginning until you did the Kofinas protocol.
Right. So it was frozen and Kofinas protocol we got pregnant 2016. It was an untested embryo. It didn't work out. Then we went back to the drawing board. We didn't have any embryos left. We went back to the drawing board and actually my husband got a varicocelectomy during that time. I took a break and did a huge cleanse in my life for egg quality. Went back to the drawing board and started trying again. And I believe it was 2017. I was almost 43. We got 3 blastocysts and 2 viable embryos.
And did we test?
We did.
Okay.
We tested and we got 2 viable blastocysts. And so at that point, we kind of collectively, because of the autoimmune component, we decided to only implant 1. And actually, the wonderful embryologist in your lab, I think she flipped a coin. We let her flip a coin to see which one it would be because we knew the sex. That was a fun part of it.
That was guys, just FYI, that was the genetics was still a little bit smaller.
Yes.
At the lab is people flipping. No, it's very professionally flipping.
No,
but,
I should clarify. We told her to flip a coin. She just
Got you. Yeah, it would be funny. Now the lab is being like, hey guys, one of you flip a coin.
I know. And so we then got pregnant in 2018. So just to clarify for everyone out there who feels like their eggs aren't fluffy and gorgeous, I was a month away from being 43 when we got these viable embryos. And we got pregnant and for some reason that weekend, the numbers just dropped. So we had Kofinas, the element of genetic testing and Kofinas's protocol. And we were all just shocked that my husband and I really thought, this is it. And we knew that we didn't have fiscally, emotionally, or physically the endurance to continue.
Yes.
So we had 1 left.
Yes. I still remember those nights. It was so hard. Me, you, and hubby, I was like, oh my God, Brooke, how do we do this now? Because just want you to know, Brooke, like every time, and this is, I see this scenario, I know you're one of my patients, but every day this is like my job. Yeah. And the last one, what did I miss? Or now there are more tests, by the way, Brooke. You have gone through all those tests. Like now they're checking endometriosis, they're checking this, we didn't have those back in 2017. And it was a very interesting now thinking through back that time frame, because now with more tests, we still are ending up sometimes in a happy time, sometimes not happy, because sometimes it can be the embryo, like looking back, it can be the immune system, but you were already doing all the autoimmune therapy. So at that moment, I'm going to actually ask you more questions about the process with the autoimmune therapy and how you went through it, what's the cost, because this is where patients always have questions. Why didn't my embryo stick? And if they stick, why didn't they keep on sticking until live birth? Why did they let go? So I want to go through that first before we talk about the options, gestational carry, which you went through also the process of choosing. So I just want to, in summary to our audience, we only have two. We had one more time at 43, we got 2 normal, and I remember talking to you and Peter is that this is it, Dr. Luk. Financially, we're drained. Luckily, I was praying to, I don't know, nature or God. I don't know if you're atheist. Now I'm the one that the universe. And so somehow we got these 2 euploids. And now, knowing your history, we went through the autoimmune, but we still had a miscarriage. So before I going on to the last embryo, what we did and how we went to, the happiness is what was explained to you when you go to an autoimmune doctor. What was the process usually? Even like when you have, because you did have a reason for me. Like I said, rheumatoid arthritis is not usually a common disease for younger women. And lots of women ask me, Doctor, do I need to see the autoimmune doctor? And nowadays it's a very hard question. I would say, well, I had this patient. But if you want to, I never want you to strip out your rights to do empowerment. But the problem is the empowerment costs lots of money. So that is where, Brooke, share when you first, even me introducing you this Miss quote unquote autoimmune doctor, or there's only a few, by the way. I don't know if you know, left. They're also getting older in the city. The insurance usually not cover. So I just want to hear what's the process?
The first round of bloods that were so deep into our genetics, both of us, and I'm so sorry, I can't remember the names of those tests.
It's okay. They were doing HLA, CD130.
Thrombosis, checking for all sorts of blood flow issues. So that was, I believe it was a couple of grand, and that was not covered, just the tests. And
it was very clear it was not covered when you first met.
No. At least the insurance that we were on at the time as 2 showbiz kids was not covered. And then we went on to, oh my gosh, what happened next? He came to us, we sat for hours, and he says, you've got thrombosis. You've got, oh my gosh, I'm so sorry. What was the diagnosis? Literally, I had
no, that's okay. Yes, it's an anticoagulant. Yeah, yes. They say you're hypercoagulable. They check protein S, and they just found something that may more inclined to have blood clots.
And to be honest, it was so overwhelming at the time, and we knew that it was going to be sort of in tandem treatments with yours. We were like, whoa, can we afford this? But we have to go for it because we've gone this far. We have to, continue. So he suggested, and it started to explain to us intralipids, and I did intralipids every week from transfer through.
Now, how do you arrange that? Do you get intralipid at home? Do you get intralipid at the office?
So I went out to Brooklyn where Kofinas Perinatal, he was practicing at that time, and I got it. His office gave it to me.
Okay.
Then later on, we were able to find a nursing in-home nurse that would deliver and come to.
Because the cost is a little bit cheaper. I heard.
They would deliver the medicine to me, and then she would come and do the intralipids at my house.
What's the feeling? How long does it last to drip?
Around 3 hours. Makes you a little tired. It makes it's sort of like. It's one of those things every week that you can't work during that time. You can't, so it's carving out those 3 hours, 3 or 4 hours, making sure you feel good after they stay.
It's like once a week, right? During your gestation.
Once a week. And I actually did it through my pregnancy.
Okay.
And then we started Lovenox injections for blood thinners. We started metformin, which is a diabetic medication.
Yeah, it is.
And it was, that is not a great feeling. It's a very, very, it was hard on the system. Let's put it that way.
And Brooke, did you, and this is where the, as you and I had lots of back and forth on this because there's lots of money. And you also asked me, Dr. Lou, is there any clinical science to prove, this is working? Because like, why didn't we do it even the first, couple transfer?
Right.
And I said, well, because there's no clinical, that's why it's not covered by insurance. And I, like I said, you're a very special patient where I went through the whole thing because some of our patients may went through it and then they get pregnant and then they will stop doing it, even though they may have found that panel.
Right.
And did you find the difference as in your feelings when you do those, or is more like just have the pregnancy stick? That's how you feel.
It was more about when he explained to me that, your body is rejecting Peter's DNA. Right? Your body doesn't know. Your body releases a chemical that attacks your own joints. So when this is the thing that we need to do to suppress that from happening so that the environment is ripe for a tested embryo to grow, to live birth. And the more I got to know him, the more I got to know the staff over there. They just are really dedicated in a part of science that is not talked about a lot, which you had said. And I started to really believe in what they were doing. And so that really helped me emotionally sort of get over all the things that I needed to do every day, like 30 supplements, I was doing anything. I remember like traveling so much at the time and not going through the x-ray machine, like it was little things like that. I changed everything about my, he also suggests a lot of other things, but everything about my home was organic. Everything I touched, everything that every product I put on my body. I really went to every length that I could to make sure that I did everything I could to get a viable embryo. And then we did everything we could for the environment of that embryo to grow. And then if we did that and it didn't work out, because that's how I felt in 2018, I started to think of it there was such duality about my mental resilience. It was like, okay, I can see our lives. It's going to be okay if it's just Peter and I.
Right.
Like I had to start thinking in those terms, as well as holding out hope. But that's when it split for me mentally. I digress. It was just sort of like, and I think it's also like our background as performers and dancers. We're like, do it all, do it. Not in a forceful way, but you have to do everything you can before you let go.
Right.
And that was really what got me through all the extra protocols and all the extra times. And I would stop and you wouldn't see me for a couple months. I would go to, China, or I would go overseas to work.
Yes.
And I would be like, I'm back. Now we have money to do IVF. Let's go. You know what I mean? But it was really one at a time. We had to stop and get the money and then come back to you and start over.
And I know this is because of that last embryo. Yeah. That was a big, and I have lots of those stories. Obviously, I told you it's a part of my profession, but it never gets old. Like my emotions still go with the patient. I still remember that moment when I knew the beta drop, how I knew it. Like it's all in my mind still. I have those kind of memories. It's horrible and great. I guess it's a blessing.
Totally.
So how did you decide? I remember you also had a gestation carrier on the wing waiting because that was it. This last embryo.
Well, it's a lot of ego around, I think, wanting to get pregnant. Because I know that you had mentioned, and I'm sidestepping here, you had mentioned, are you sure you don't want to maybe think about, should we think about an egg donor? And I was always so it is your ego, right? You want to reproduce your own egg, right? And I was like, no, I was very clear about that. And then I started to say, well, maybe I need to strip my ego back from this. Maybe I should give our last embryo the best chance at being in a surrogate. So actually a friend of ours, and at that time in 2018, it was illegal in New York State. So we were hooked up. You guys hooked us up with the clinic in Connecticut. We were like, we're going to rent the tank. We're going to rent a car. We're going to bring it out there. I mean, and my friend had already started. We had already
evaluation.
Oh yeah.
She met the autoimmune doctor.
Correct.
Yes. So
we were like, we should do everything, right?
Yes.
So we bring her to Dr. Kofinas, and she is a wonderful human that was so selfless and wanting to help us out. And we went, and some of her blood work came back And it was, there was
like
blood flow.
Yeah, the blood flow issue.
Yes. And
coagulation. You look at Peter's like, what the heck? Me, you're like, so why are we
so she,
doing the gestation care if they say
right.
yes?
So we said, hey, this is what we need to do everything that we can for this embryo. And she didn't feel comfortable with his treatments. And I respect that so much. So
right. So she also doesn't want to get on Lovenox,
all of the things and Trillipids, all of those things. And we had already started the process. She was already in a med cycle in Connecticut.
Okay.
And we stopped the process. I think it was like maybe 9 days before we implanted our daughter, our last embryo, into the surrogate. And we were like, okay, we're calling it off, because at the end of the day, we'd come this far. How could we not?
Right. If we believe the science. So this is where I challenge. And then I said, Brooke, do you believe in science?
Yes.
Because now this kind of test, this is why it's not, again, not to offend any autoimmune doctors out there. There's some people they don't see it, because now you have a healthy, because your friend, I think, had children before.
Yes, she has 2 kids.
And usually when, not just yours, I have a couple patients when they're French GC or something, they feel they're very healthy to help their colleagues or friends out. They don't want to be on extra or something. They just thought it would be easy, like the way they got pregnant with their own child. So it was very interesting also is that, oh, wow, why are you giving me all this Lovenox? And I don't feel sick. I'm great. I can carry another,
totally
deliver another baby.
And I respect it, but it was just our path to have to push it to the very end, do everything.
Right. And so my question for you is then, how did you decide that you ultimately, and what path I think we did a hysteroscopy, we did certain things.
Right. I think we checked.
Reevaluate the cycle again.
I came in, I had been working overseas for a long time, and I came in and I was, you looked at me and you're like, you and Peter were kind of like, you're not ready. You seem tired, you look underweight, you don't look ready to do this.
Right.
And I had... But any sort of reevaluation of my body came back okay. And we were all deciding together. You and Peter were kind of like, you should give it a second. But this was January 2020. And thank goodness that I'm so pushy because I looked at both of you and I was like, we're doing it now, because I literally couldn't. And thank God we did, because the clinic shut down. I mean, the COVID hit and then I was pregnant. Right. So, but it was sort of like,
oh my God, you're right. You're right before.
Yeah. So I knew that
That's so exciting.
I could not take it anymore. I'm like, we have to go left or right. There's a fork in the road for me and we're at the fork. And I needed to know the answer. I had to know the answer. And it was our daughter.
This is amazing. I'm so happy.
Thank you. Sorry.
So crazy. And COVID hit. And,
we were high risk and all of the things. And the doctors at Cedars, I landed in their lab because we ended up being in California. I'm like, what are you taking?
Oh, yes. Yeah, let's talk about it. So you're on Lovenox,
Intralipid, all of it. And they look at me like I'm crazy. Like, no.
And now you're in California.
Yeah.
Were you there for the whole gestation or just?
I left for a job March 14th, 2020. And we stayed. We didn't mean to move, but because of all the things that were happening in our lives and I was still working there, we stayed for 3 years and I ended up having my daughter there. And I found a really amazing one MFM there, Dr. Steve Brad, who was open to working with Dr. Kofinas at that time. And because I needed him to prescribe me all these things, right? And I'm like convincing these doctors, I'm like, no, this guy knows what he's doing. I need these drugs to help me, and it was just so emotional. But in the end, they really made a connection with Dr. Kofinas. And now some of his patients were recommended. I mean, it's all about that one. And even today, like it's one person, right? If it helps one person, it's all worth it.
Well, it was, that during that time, I can imagine, because most doctors love to stop all of it. Mm-hmm. Like here in New York, if I have patient on those autoimmune protocol, but then how do you work it? How do you transition safely? That's really
right.
The most important thing. Well, Brooke, I can't, it is so, you don't understand how much joy this rejuvenates me. And I'm now practicing more than 10 years. So, you saw my career, like half of my time in my office and being with me. So it is amazing. How do you find the strength? Where's the resilience come from? Where's this, why have that courage? Say, you know what, Luke, I understand all the back and forth. and don't have that blame. Like I have some patient really angry. They sometimes, maybe they will say, Dr. Luke, I walk around. That's why me or their partner, I forgot that medication. That's why I miscarry. How do you say, you know what, I will try to do everything I can, and how to say, this is my best I can do, and let that kind of like not blame oneself go.
Yeah. I mean, I think,
especially when you have rheumatoid arthritis and all.
Right. I mean, I think for me, it was always about that, was like, because I felt my disease getting worse the entire time. Like there was times where I couldn't walk, I couldn't move my hands. I mean, I knew that I was sacrificing my own health to try to have this child. So the mental resilience was just like, we got to do this because I got to hurry up and be able to get on so that I can be around for and be healthy for a kid. Right. So the treatment, I needed to get to treatment. And treatment at that time was, methotrexate and which I'm on now. And I just fought it. I remember talking to you about it. I'm like, I really don't feel instinctively like I can be on these biologics and be on these disease modifying drugs and try to create a healthy child. And that was just my take on it. So I chose to postpone all of my treatment. So that was really where the mental resilience was for me, is to get to the answer so I could treat myself. And actually, if I'm not going to be a mother, I still want to be, a healthy human in the world that isn't, getting joint replacements too young. But again, I think 2018, that second pregnancy, even though it was a chemical pregnancy, that was the turning point where my resilience turned into, you got to start looking at both scenarios. And I don't think that works for everyone. It did for me, because it was too punishing to think, oh, it's me, I'm old, it was my eggs, and then turn it inward. Right. And I think I had the tendency to be, why didn't you start earlier? So to start to think of it and imagine our lives and what we would do and how we would live, and sort of visualize that, and visualize the life that we want with a child at the same time, and sort of split that energy. That helped me. I hope I'm answering your question, but it really helped me with the resilience. It's like, okay, we've come this far. I've come so far. How can I give up now?
It's like you're using a method like people stress. I don't know. There was one, a very smart entrepreneur said, stress is that there's a problem, you cannot do anything about it. But for what I've been treating both you and Peter, is that you guys will say, if there's a problem, let's find a way. If there's something we choose not to do that way, then we'll have to do the other way, like the gestational carrier. So I felt that you have to, a great friend to, some patients don't have the resources, then that's it. There's no way. So I said, don't need to keep on going to that direction. There's no way. Then why do you find the second or third way? So there's lots of kind of a discussion also with patients sometimes.
Yeah, I think it's also, it changes. I think how you approach where you begin an IVF journey, in the middle, and where you end it, no matter what the outcome, it is a true roller coaster. So how you feel and how you think you're going to feel.
Yes.
You can't plan for it.
Yes.
It's shocking. And that's why I'm so grateful to you and Dr. Najat, because you guys practice medicine with a sense of vulnerability and humility that isn't in the world. So thank you.
No, thank you, bro. Thank you for coming on to my show.
You're welcome. Thanks for having me. I only cried once.
That's great.